Hi, I'm Samia McCully, naturopathic doctor, and today I'm going to talk about hypothyroidism. So, hypothyroidism is something I specialize in. I'm very passionate about it and often frustrated by the multitude of patients who come into my office looking for help with it because their doctors have ordered just a TSH or a TSH and a T4 and told them that they're normal, and they come to me searching for something more because they don't feel like they've been served, or they just in their gut they feel like something is wrong. If you have issues with anxiety, depression, muscle cramps, PMS, if you're cold in general, if you have cold extremities, if you have fertility issues, if you are tired, if you have difficulty losing weight or just keep gaining weight, if you have heart palpitations, if you have fluid retention, if you have if you don't sweat that much, I could go on and on and on. And the reason I could go on and on and on is because literally every single cell in your body has a thyroid receptor. So when you have low thyroid hormone, any number of things can happen to you, and each person can look different. So if you think about it, if you have a bank and you have $100 and something costs $100, you can buy it. But if you only have $25, maybe you can buy part of it. So with your thyroid, if you need 100 thyroid hormones, that absolutely makes no sense how I'm saying that, but if you need 100 of something and you only have 25, your body's going to give some of the hormone to some place. So someone may be tired and the next person may be anxious and the next person may have heart palpitations, and maybe if they only have 12 instead of 100, they may have all of those symptoms. So it can vary greatly, and a lot of times people end up going to their doctors and they get treated for all these different symptoms, and they get a different drug for every different symptom. Insomnia is one of them too, actually. And so when I do thyroid testing, I look at 9 different things initially. I look at TSH, I look at free T3, free T4, total T3, total T4, T3 uptake, reverse T3, and antibodies, antithyroglobulin, and anti-TPO. If your doctor's not looking at all of those, then they're probably missing something. Sometimes your TSH can look normal, but there's something else going on in your system. And if you were to just test more of the hormones, like the free T3 and free T4, or total T3 and total T4, you could actually see that those numbers are totally off. And so because I test all of those numbers, I end up catching a lot of things that other people may miss. And so all of these people who come in thinking that they're hypothyroid may not necessarily be hypothyroid. They may be subclinically hypothyroid, which gives them the symptoms of being hypothyroid, and maybe their numbers are suboptimal, but we can still treat them, sometimes using medication, but a lot of the times there are other things that we can do to help them feel better and to make their numbers actually go back to normal. And if you don't look at everything, people go for years, they go from doctor to doctor, and with great frustration. So if that's something that you struggle with and you really want to get your thyroid tested, that is something we do here at Wellness Architecture all the time, and something that you might want to look into.